Afternoon to you.
Yes, hi.
We are with Dr. Dhruti Mahajan and welcome to Indore. So before starting with anything, I want to know it's been how many years you are practicing and where are you practicing it?
So I'm basically based in Mulund, Mumbai. I'm practicing for last 9 years. Yes.
So today we're going to be talking about OAB.
Yes.
The first question over to you. Can you please describe for the viewing audience that what is an overactive bladder and how does it impact the quality of life of a patient?
Correct. So overactive bladder is a symptom complex where patient would present with frequency, urgency, with or without urinary incontinence. So basically, it's a very disturbing, distressing disease, you can say, not because it is life-threatening, but because it has a very negative impact on the quality of life of the patient, and hence the patient has not only a physical problem, it's also a social, emotional, psychological problem, and that's why it needs to be dealt with great seriousness.
Okay, heading towards the next one. Why do you think that the patient with overactive bladder delay their visit to a healthcare specialist to get their condition checked out? Is it because that they feel that this is not a significant condition to be diagnosed?
So maybe sometimes it is that they feel the symptoms are too trivial, and sometimes they are shy because of the social stigma that it carries with. So they are embarrassed when they are out in public or attending a social function. So that makes them a slightly regressive, and hence they would hide those symptoms and try some alternative methods without coming to a doctor and getting themselves checked.
Next one to you. What are the cons of delayed diagnosis? And can you please share with us an example where the patient with overactive bladder delayed their visit to a doctor and what was the impact on their health?
So basically, see, overactive bladder has got a lot of causes. Sometimes it might be just these symptom complex. Sometimes these complex symptoms can be because of any other disease. There can be stone, there can be infection, which is associated with these symptom complexes. And as long as it's not associated, it is still okay if they delay. But if there is any pathological cause and they are kind of neglecting it, sometimes they would land up in bad urosepsis, requiring ICU admission, multiple IV antibiotics. So I feel these symptoms should be taken seriously and should be investigated. And the best part is with proper treatment, counseling, a lot of therapeutic options that we have now, they can actually have a very good quality of life and get rid of their symptoms in most of the cases.
Okay, well, lastly, over to you. What role does behavioral therapy play in the treatment of overactive bladder?
It does play a very important role. So it's a major chunk where a lot of lifestyle modifications are also involved in treating overactive bladder. Behavioral therapy is one of the most important modalities of treatment along with certain medical therapies that we prescribe the patient. So yes, it is important in treatment of overactive bladder.
Well, that's all. Thank you very much for your time. Have a great day ahead.